Hi, welcome to my presentation. This is Dr. Vasu Brown. The reason I'm doing this presentation is because I have had people ask me questions about what MTHFR mutation means and if it is abnormal, what to do. And there are a few things I usually discuss with the patient, but for some reason I find people do not seem to understand what I am saying, and then they end up calling me again to let me explain it to them. So my goal for this presentation is to allow people to take their own time to process each slide so that they can go back and listen to it. This way, the processing of information is easier because it might seem like a lot of information. But if you just simply understand there was some problem with the genes, and for that you need to do things slightly differently if this is abnormal. I will try to make it as easy as possible so it's not that complicated to understand. Thank you. So in the slide 2, what we are going to talk about is what is the results typically mean. The MTHFR is a gene that helps us understand how people process methylation in the body. Why is methylation important? Methylation is the way the DNA repairs itself, and it nourishes the body and also cleans the body, okay? So if there is abnormality, there are 2 copies of these genes. One is C677T, and the other one is A1298C. So the results are typically reported either it's a negative result, which means everything is normal and the body is working well, or positive. If the positive means there is some sort of a variation in this gene, and that's what it's called mutation, meaning it has switched itself a little bit. So usually what it means is that because of this mutation, the body is not producing the end process, when we consume food and stuff, it's converted into energy producing vitamins and amino acids. So what essentially is happening is even if you're taking B12 folic acid, it's not getting converted into methionine, which is one of the amino acids. Instead, there is a higher level of homocysteine, which actually causes increased inflammation in the body. So what is the reason we need to worry about inflammation? When the body feels more inflamed, the body is not going to clean itself well. That's one thing. The second thing is it's not going to have that much energy. So the presentation would be like lots of body aches and pains, fatigue, and not able to repair itself, and also increased inflammation inside the arteries, causing atherosclerosis and early heart disease. And also if people develop wounds and stuff, they are not going to repair their tissue, so they will have a higher chance of having chronic wounds and not able to repair their body very well. Okay, these are like some of the things that is worrisome. That doesn't mean that it is something that is very stressful. If you just understand how to clean yourself, how to bring down this inflammation naturally, you do not need to worry. For example, when the homocysteine level is high, it means you need to give more energy-producing substance to the body called glutathione. Glutathione naturally is available in the body, but because the need for higher energy exists in the body, you need to support externally. Also, you need to pay attention, and anytime you develop aches and pains, you want to clean your body, detox it frequently too. And also, pay attention to how you feel when you eat, whether some food works well, then continue doing that. But if it doesn't work well, understand how to clean yourself frequently too. And the other thing is, then regular way of taking vitamins might not work for you, so you might have to take it differently. And now I have a patient who was worried about getting pregnant, so because there is a higher chance of folic acid not assimilating, you need to really do the right way so that if there is a pregnancy, then you want to make sure, because if the folic acid deficiency exists, neural tube defects are common in the developing fetus, so you want to make sure the vitamins you take are going to be assimilated by the body so that the growing embryo can utilize it, okay? And so there are usually 2 copies of the MTHFR, CE677T would be there, but if by chance there is only 1 copy of C677T or one of A1298C, then there is a chance of higher homocysteine levels. So measuring homocysteine levels, once or twice a year would help to understand, how to adjust your homocysteine levels. And these tests are pretty simple. You'll be able to have your primary care physician do these tests for you. And I will talk more about how to take care of these issues in the latest slides too. So the MTHFR, the positive results. What else do you need to do? So the second thing is to have, like I said, a blood test for homocysteine levels, so that you can monitor your inflammation. The other thing I forgot to tell you is, if in case the homocysteine levels is not detectable, specifically for younger kids, it means their glutathione is so depleted, they are not even producing homocysteine. So, homocysteine subnormal is also not good, and usually this is common in children with ADD and attention deficit hyperactivity spectrum of disorders. And so when it's abnormally low, also it's a problem. Then you do need to replace glutathione. And in adult population, higher levels is also a problem. So we need to watch out for normalizing it. The other thing is, blood gets sludgier, meaning it's not flowing well, so there is a higher chance of clot formation, which is a risk factor for heart attacks and stroke. So we need to make sure the blood stays thin by using medications that would help the blood not to have clots, so that your doctor can work with you to understand how to do that. You need to figure out whether aspirin therapy would be one of the goals for that, or vitamin E levels. You want to watch and work with your doctor so they would be able to guide you appropriately. But just because these mutations exist doesn't mean you're guaranteed to get a heart attack or a thrombosis. If you really take care of your body needs appropriately, then you can bring down your cardiac risk. So you would have to work with your healthcare practitioner to understand how to adjust these things. And also, you need to understand the vitamin requirement that depends on homocysteine metabolism. You want to be careful not to expose yourself to something that would require this type of mutation. So if you're taking folic acid and vitamin B12, you need to adjust it in a different form with your doctor's help. So the study of MTHFR genetic mutation showed increased risk of high blood pressure and seizures in pregnancy. And also neural tube defects. Like I said, it's because if you do not take the proper form of folic acid, you need to take it as folinic acid, which is slightly different. And you do really need to work with your healthcare practitioner so they'd be able to help you. And there is a higher risk of cancer. But all these, like, you can adjust provided you understand how to work whenever you get even slightest symptoms of, like, toxicity, like whether you have constant fatigue or body aches and pain, and try to, like, do cleansing and detox frequently, so you would be able to adjust your body needs and modify the amount of toxicity you're exposed to. For me, the quick way to cleanse is you can do a nicotinic acid cleanse. So that would be something you would have to learn or work with your doctors. Like, again, this is not something you can, like, just go about and do it yourself. You need to have your healthcare practitioner involved with your care, who would go over the proper way of doing a cleanse. When you do a cleanse, don't do it all the time. Do, like, a 3-day cleanse followed by replenishing of the nutrition maybe for 2 weeks. So do it in cycles so that you do not deplete all your minerals and nutrients. And also because these genes the detoxification methods are abnormal, you need to really be careful. And some of the medication needs to be adjusted. Like, for example, like methotrexate has to be adjusted as one of the examples, because the toxicity symptoms would happen quicker. And also many of the environmental toxin can affect this person more than other population. So what the hell the MTHFR gene does? Okay, so once you understand that, you know what it doesn't do when there is a problem, right? So the MTHFR gene produces the MTHFR enzyme, which works with folate, vitamins like B9, folic acid, and breaks it down to 5-10 methylene tetrahydrofolate. And this helps convert the amino acid homocysteine to another amino acid, methionine, which is the way the body makes antioxidants, and it also helps the liver process the fat. Okay, and also methionine helps with depression, inflammation. It converts estradiol to estriol. So healthy methionine is converted in the liver to SAMES, adenosyl methionine, which is anti-inflammatory, supports the immune system, and also helps the brain's chemical serotonin, dopamine, and melatonin, which is involved in growth, repair, maintenance of your cells. Also, methionine is where you get those padded-looking skin, where the skin looks like soft, supple. So it really helps to support the basement membrane and to rebuild the tissue. Methionine is very good so that the younger-looking skin persists in a body. And so the proper methylation pathway is the way the body repairs itself. It eliminates toxin and heavy metals, reduces the risk for cancer, and also put less stress on adrenals. The other thing is methylation is the way DNA repairs itself. So if there is abnormality in methylation, people age quicker. So that's another way you can say when people do not methylate, they mutate their DNA. The DNA breakdown happens, and the aging process is accelerated. And for proper methylation, the healthy way to methylate every day when people eat is to take hydrochloric acid with choline that